The biggest failure of the Trump administration response to coronavirus has been the lack of testing on the scale needed. They announced this week with great fanfare they're going to have over 1 million coronavirus tests available at the end of the week. And at the time they announced that, it was obviously false. Anyone who knows anything knew that the logistical obstacles were too big to get there by the end of the week. And then today, guess what? Senators confirmed we aren't going to be testing at anywhere near that scale. Republican Rick Scott admitting there won't be 1 million people to get a test by the end of the week. It's way smaller than that. Now, it's defensible to not be scaling up to 1 million this week. But what is not defensible is that the lack of testing we have means we do not know how many cases there really are in the United States. Again, the Centers for Disease Control says that there are just 99 total cases in the country, with 13 states reporting cases. NBC News has found the numbers are higher, at least 226 cases at last count in 21 states. Now, what has been clear from the beginning is the president of the United States isn't really primarily interested in dealing with the virus itself as a first-order problem. No, he is interested in spinning it to preserve his political standing and the standing of the economy. And last night, he was doing a doozy of it on Trump TV.
We have a report today, the global death rate at 3.4%, and a report that the Olympics could be delayed. Your reaction to that?
Well, I think the 3.4% is really a false number. Now, this is just my hunch, but based on a lot of conversations with a lot of people that do this, because a lot of people will have this, and it's very mild.
Now, there's a responsible way to communicate what the president said, which is that the 3.4% mortality rate is not consistent across all countries, which probably has to do with a lack of testing. In South Korea, where they're doing a ton of testing, more than anywhere else in the world, the fatality rate there reportedly appears to be hovering around 0.65%. Much better. That is hopefully what we will end up having here. But you can't just dismiss the World Health Organization figure based on a hunch. And then the president says something unbelievably revealing about people who have the virus and don't need intensive medical care.
If, we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work, some of them go to work, but they get better.
That's the president blithely suggesting going to work with the coronavirus, which, listen to me, do not go to work with the coronavirus, okay? Joining me now, Ron Klain, who served as the U.S. Ebola response coordinator under President Obama. Testing continues to be a real problem, even after the announcement they were sending out these kits. How do you assess overall the response to this administration so far?
I mean, I think you have to give the response a pretty low grade. I don't C-, D+, whatever you want to put on it. For a couple of reasons, Chris. They focused on travel restrictions to delay the arrival of the virus. Now, we can talk about whether or not that worked or not, but what it bought was time. That's only a valid strategy if you use that time to ramp up. So, yeah, it was reasonable that on Monday, when they said there'd be 1 million tests by Friday, no one should have believed that. But there should have been 1 million tests way before Friday, because we knew in December and early January this was coming. And why did we start really just working on this problem this week? Same thing with hospital capacity and all the other aspects of this. The response is moving slowly. It's starting late, and that's inexcusable.
The president had this, he talked about his sort of bragging about the numbers today. There were two tweets. So in one tweet, he called you a lightweight Washington failure and was mad about the swine flu and a lot of people dying that. And then in another, he said, look, we've only got 129 cases and 11 deaths. We are working very hard to keep these numbers as low as possible. And it struck me that that was a very revealing sentence. We are working very hard to keep these numbers as low as possible. It's the numbers. But if you're not testing, that's one way of keeping the numbers low.
Yeah, I mean, it's like a double entendre tweet, which is what they're doing to keep the numbers low is being slow about testing. And in the end, you can't hide sick people under the sofa, okay? We are going to have to find these people, treat them, get them into the healthcare system, get them well, isolate those cases to the extent possible. And if you don't test, you don't know. He is focused on numbers. He's focused on the stock market being up and the case count being down. Those are the two wrong things to focus on. He should be focusing on getting people tested, surveillance, finding out where this is, and getting hospitals ready to deal with the inflow of patients.
So one thing I wanted to be clear on in our coverage of this is that the idea that the individual risk to an American is low is correct. There's 330 million people in this country. Even if we were facing an Italy-sized outbreak, which was large, that would be 25,000 cases, right? They've got about 5,000 cases, 60 million people. So, again, in the relative scheme of things, the risk, though, is to the healthcare system. Explain why that is.
Well, first of all, I do think the risk of number of cases could be a lot higher than that. They're testing in Italy, but not testing nearly as much as they should be also. Right. And so I think the fairest thing to say about the number of cases is we don't know. I think we should begin and end with that, okay? Right. Now, it's going to be a pretty big number in the end. And our healthcare system is fragile, right? It runs at capacity. We don't have hospitals just sitting empty, waiting for coronavirus patients to show up. So if you put stress on that system by a disorganized response, by people in a particular city, whatever city it is, flooding into hospitals, flooding into emergency rooms, that will, really collapse the capacity of those hospitals and emergency rooms. It may infect doctors, nurses, and frontline healthcare workers. And those things will take down part or a lot of a healthcare system in a particular area. So even if you don't get coronavirus, if you need to go to that hospital to get treatment for a heart attack or an urgent birth, and there are no respirators, or the nursing population's down a lot because they're sick, or the doctors are out because they're sick, that's going to have effect on all of us, even if you never, ever get coronavirus.
How much was communication, straightforward, honest, clear, fact-based communication, important to you when you were coordinating the Ebola response?
Look, it was very important. And ironically, that's one reason why I didn't go on TV at all the first month of the Ebola response. We put Tony Fauci on television. We put Tom Frieden on television. The American people should hear from experts, from the people who know the medicine, who have been career officials, who can. Tony Fauci served 6 U.S. presidents back to Ronald Reagan. He fought AIDS. He fought malaria. He fought all kinds of diseases. People should hear from him directly about the facts and the truth. He now has to go in events with the president and correct the president when he misleads people in real time. He's like real-time fact-checking. That's not the way this should work.
What is your hope that you see happen in this response you haven't seen?
So I think 2 things really have to be fixed. We have a problem of competence. We have a problem of confidence. And we need to fix both. On competence, we need to ramp up the testing. There's just no way around that. And secondly, we need to get the touch points of our healthcare system, the intake points, ready for these cases so that we don't collapse the healthcare system in particular areas, particular systems. That's the competence part. On the confidence side, the president needs to put down the iPhone, needs to stop saying ridiculous things on camera, and let public health authorities brief people and tell us the truth.
Final question. Has the White House or anyone in the White House reached out to you for your expertise?
I haven't talked to any senior people at the White House. I continue to talk to career people throughout the government who work with me on Ebola response. Those career people, what Donald Trump disparages as the deep state, are what's going to protect us and save us in a situation like this.
All right, Ron Klain, thank you so much.
Thank you, Chris.